Chris Sands, my Georgia Bulldog alumni friend. I want you to pop in here and give us some ProFi 2020 wisdom. Let's talk about cash flow and all things profit. So one of our listeners said, I listened to the webinar, I still don't get it. I pinch every penny that I can, and I can imagine how I would increase my profit. What else can I do? So other than just, laying people off or I can't pay less rent, what do I do?
Well, Victoria, that last comment you made about some practices just need to grow the revenue, I think that's a key component. If you're focusing on, profit equals revenue minus expenses, I think the focus has probably got to be 80% on revenue, 20% on expenses, maybe 90% on revenue, 10% on expenses. And ask yourself the question, are you making the proper reinvestment into your business for revenue growth to exceed expense growth? You have to understand that and accept that every single year you're going to have a growth in expenses. People asking for raises, cost of supplies going up, rent going up. Their expenses are going to grow by some at least single-digit percentage. And the question is, does your revenue grow by a higher percentage than that? Okay. And, increasing revenue on the same fixed costs is what leads to more profitability. And dentistry is fairly simple in that most of its costs are fixed. There's only 3 or 4 variable costs, and those are doctor pay, labs, supplies, and maybe the credit card processing costs, which are variable with how much production and therefore revenue gets generated. So I would say ask yourself, are you making the proper reinvestment into the business for, marketing, hiring, training to get more patients, to be more efficient, to have greater case acceptance, and to, collect a higher rate of what you're producing? I often tell people, look, just focus on the small things, small metrics. Can you maximize your revenue per chair in your space, which I define as $35,000 a month per chair? So take the number of chairs you have times $35,000 a month times 12 months, and that'll tell you what's the max revenue you could do in your space. Look at the revenue you're doing today and see how much unrealized revenue is there. And that should bother you, because that should be your goal to achieve, to be best in class or investment grade practice. You'll be, to maximize that, you will sell at the highest value. And I think it boils down to, my equation is that every doctor should be doing $1 million of production in the organization, whether that's a solo doc or multi-docs in the practice. And if there's hygiene, then every hygienist should be doing about $250,000 a year. Okay. And 2 hygienists to each doctor. So the solo doc kind of max, you kind of defined it. You said you work with a lot of practices that are doing $700,000 and they're working toward getting to that 1.2, really around that 1.5 million, is kind of a maxing out for a solo doc with at least 2 hygienists. And you break that down to a daily number. Can you target $5,200 a day per doctor at minimum? That's a digestible number. Can you target $1,300 a day per hygienist at minimum? That's a digestible number. And that's what gives you the $1 million doctor and the $500,000 of hygiene with 2 hygienists. So
go back to your daily for the doctor. I think I put that wrong.
So I do the math. $1 million divided by 12 months is $83,333 a month. And if they're working, 4 days a week, that's 16 days a month. So you should divide the 83,000 by 16 days. It's $5,208 a day.
52. Okay, that's awesome. Thank you.